And one of the things I was going through and I was looking at some of the stuff that you guys have been looking at, and I would love, Jim, for you to dig into this idea of DLT anchoring. And this is going to be addressing one of the main problems that Jacob mentioned here, and that was the access to data and the fact that that was so difficult, and how this is going to help solve that problem. Jim, could you dig into that a little bit?
Yeah, no doubt, Brian. So look, as Jake mentioned, the data that we deal with in healthcare research is siloed, is all over the place. So one of the underlying issues is, can you trust the data? Is it timely? Is it the latest data? Was it consented correctly? Is it authentic? All these questions are difficult to answer when you don't really know, when you don't fully control data. And I think we are long past the days of saying, let's just have one gigantic database, you name it, vendor of your choice, IBM, Oracle, whoever, and let's just put everything inside their system and have one vendor of choice, Amazon, whoever, manage it. I think that's just never going to happen anymore, and for a lot of very good reasons. So I think the real question is, and this is really where Jake and I are very much in line, is to go and innovate into the future, you need to think interoperable data. So data is coming from different places. You don't necessarily control the source of data. So then the question is, well, how do you make sure that the data, as I was mentioning at the beginning, is authentic? Is the person who touched it was actually allowed to touch it and did it in a way that was accountable? And that's really where this distributed ledger technology anchoring comes in. And it's very, very simply, we have the ability, especially if you implement it correctly. This is not a general statement, because if you don't implement it correctly, it may not be fast enough, it may not be affordable enough, it may not be usable enough. But I think it can be done, in a way where all those things are met. But really, what it amounts to is that when you, for instance, touch somebody's data, you record at the same time. You record an immutable, essentially pointer, a transaction reference on a public ledger that says XYZ entity in a privacy-preserving manner. Touch this data, and here's a consent that allowed him to do so. And sometimes that consent comes directly from an individual, like me. I'm providing my health profile, and a clinical researcher can look at it for inclusion in a clinical trial. So, and if that is truly being done, that individual can also be incentivized, could be remunerated in some shape or form. And that's really where I think we're getting to. We can essentially kind of promote a much more virtuous cycle for data usage and accountable, kind of research in this way, as opposed to what it is now, which I think is much more of a vicious cycle and very much untrusted. And I can tell you from my own experience, even having dealt with it at a very large scale with federal government, where you think where the data is coming from. In most cases, you'd have to do a second, third, fourth revisit to the original data source of data to verify whether or not that data was legitimate or timely or what was consented, and all of that makes it very inefficient.